everyone. My name is Juliana Ramirez. These are my colleagues, Tanya, Paris, and Cameron. We are really excited to talk to you about Project Escalate today. Worldwide, cardiovascular disease is the #1 cause in death. Our heart is a loyal organ. It works constantly to keep up with the bad habits we have, whether that's smoking, drinking, or having one too many fast food meals. Depending on everyone's age, I think we've all done something like that. Our heart is a resilient organ, and those activities catch up to you after years of repeating them. The COVID-19 virus, on the other hand, takes a toll on people with pre-existing cardiovascular conditions. The virus accelerates cardiovascular-related deaths. Those diseases at risk for COVID-19 include coronary artery disease, people who have suffered heart attacks, valvular heart disease, cardiomyopathy, and arrhythmia. I'd now like to talk to you about how these diseases manifest each other, a domino effect, if you will. When a person has one too many fast food meals, smokes, and drinks over a long period of time, they can develop plaque in their arteries. If they are unlucky enough, plaque can lodge itself in a heart vessel, causing coronary artery disease. The plaque now blocks off necessary blood flow to heart muscle, and a portion of that heart muscle dies or suffers a myocardial infarction. This is otherwise known as a heart attack. Because our heart is so loyal and works constantly to keep us alive, our heart rebuilds that part of the muscle that has died with scar tissue. Scar tissue is denser and thicker than regular tissue, so it naturally causes enlargement of the heart or cardiomyopathy. The heart now works harder to pump blood to the outside body, and the pressure inside the ventricles weakens and expands valves, causing valvular heart disease. All of this can make a person prone to arrhythmias. The COVID-19 virus directly attacks and weakens heart muscle. The heart not only has to fight against its pre-existing cardiovascular conditions, but COVID-19 itself. Most of the times, it doesn't win that battle. If you take a look at the bar graph in 2019 and pre-COVID times, incidences of sudden cardiac death were much lower than those of 2020. In 2020, they skyrocketed because the virus has hit our population. The survival rate for sudden cardiac arrest with life-saving measures and an AED is less than 11%. But most people around our world don't have things like that, so it becomes 2 to 5%. Cameron will now talk to you about how all cardiovascular risks are not made equally.
Thank you, Juliana. Sudden cardiac death affects minority populations at a higher rate than other populations. Sudden cardiac death also affects men 2 times more than women, as well as adults in their mid-30s to mid-40s. Death certificates and data show the Hispanic community is more at risk than the non-Hispanic community. African Americans in particular are at a disproportionate advantage when it comes to incidence for sudden cardiac arrest. 175 per 100,000 African American men have an incidence of sudden cardiac death as compared to 84 per 100,000 in Caucasian men. For African American women, the rate is 90 per 100,000 compared to 40 per 100,000 Caucasian women. As we can see, these disparities do exist, and 65% of these disparities are because of income, education, and traditional risk factors such as hypertension, heart disease, diabetes, and genetics. The risk for sudden death increases with age. A 50-year-old has a risk of 100 per 100,000, and that skyrockets to 800 per 100,000 in 75-year-olds. And as I mentioned before, sudden cardiac death is more likely to occur in men than women. This discrepancy is because 2/3 of women who have an incidence of sudden cardiac death have no history of heart disease as compared to 50% of men. In addition, women who are victims of sudden cardiac arrest or who have died from sudden cardiac death have more structurally intact hearts in the end. And this graph here shows proportions of patients admitted alive from 2012 to 2019 and 2020. 2012 to 2019 shows an average trend of 22.5%, and then dips all the way down to 8% in 2020 due to the COVID-19 pandemic. Now, there are many reasons for this dip, along with the COVID-19 pandemic, as well as neglect from hospitals, neglect from patients. Patients were more scared to use CPR and risk of getting COVID, and the social issues from the quarantine, such as addiction, drug abuse, and lack of healthcare that from unemployment that would cause patients not to go into the hospital, which increased death rates all around the world. Now, Tanya will talk about COVID-19 and the impact on the heart.
Thanks, Cameron. COVID-19 is a unique kind of virus. Because its genetic makeup is composed of mRNA, the virus has the ability to mutate much more rapidly, thus resulting in the different variants that affect different groups of people. Additionally, the virus has the ability to invade different parts of the body, overall weakening the body and affecting its functions. Although the virus does affect the body's respiratory systems by weakening the body's airways and lungs, it greatly impacts the heart as well. Viruses are powerful agents that have the capability of invading different parts of the body, and this can lead up to conditions like myocarditis. Myocarditis is rare, but it is usually caused by a virus like COVID-19, and it causes the heart walls to inflame. It also affects the heart's electrical system, as it can cause abnormal heart rhythms like tachycardia or bradyarrhythmia. Myocarditis can improve on its own or with treatment leading to complete recovery. However, in some severe cases, it could permanently damage the heart muscle. As said before, the COVID-19 virus invades the heart muscle directly and causes it to inflame. With more severe forms of COVID, inflammatory molecules called cytokines are released into the body's bloodstreams. Cytokine storms occur when an infection like COVID-19 triggers the body's immune system to overwhelm these blood vessels and bloodstreams with these proteins. Additionally, with more severe inflammation in the heart, there's an increased risk of blockages, and cytokine storms can permanently damage other organs in the body and the heart. Now I'll move on to talking about some of the associated risks that come along with COVID-19. One being that individuals with weaker vascular systems are more vulnerable to the effects of COVID-19, as they're 2 times more likely to obtain the virus. Secondly, heart disease is accompanied by other health conditions such as diabetes and obesity, as diabetes allows for an increased risk of blockages and obesity more inflammation. It's been shown that during COVID-19, patients have had elevated troponin levels, which means that there are signs of damaged heart tissue. Additionally, 1/3 of patients admitted to the ICU with COVID-19 have been shown to develop myocarditis. In a COVID-19 study, it's been shown that patients have had relatively increased heart rates ranging from 80 to 88 beats per minute. In another study, it's been shown that with 17 patients that were documented with COVID-19, 3 of these patients had tachycardia, which is 17.6% of the overall patients. Now, Paris will be moving on to talk about an important out-of-hospital cardiac arrest study we focused on and the impact we made in our community through Project Escalate.
Thank you, Tanya. One study from France evaluated out-of-hospital cardiac arrest in a 6-week period and compared it to non-pandemic periods. This study was a large part of our research, fortifying our view that the pandemic exacerbated sudden cardiac arrest. The study saw a much higher rate of out-of-hospital cardiac arrest at home, much less bystander CPR, and substantially longer delays to medical intervention. And a variety of pandemic changes contributed to these problems, such as quarantine, isolation, and adjustments to healthcare services, changes that we are all very familiar with. Overall, the study believes that COVID-19 was responsible for 1/3 of the increase in out-of-hospital cardiac arrest, showing the problems the pandemic has caused for the healthcare industry and the community as a whole. Perhaps the greatest value SCARF has taught us is community impact and its importance. SCARF has shown us perspective-changing information about sudden cardiac arrest in the world today, and it influenced us to impact our community in 3 different ways. First, we set up the SCARF CPR Certification Day, in which all of our ambassadors were able to get CPR certified, ready to save lives in times of need. We also reinforced the importance of performing CPR during the pandemic, as people are often hesitant to perform CPR due to COVID-19 transmission. We also emphasize the importance of getting vaccinated. As my colleague Tanya said, getting vaccinated, COVID-19 has direct and indirect links to diminishing heart health, and getting vaccinated can suppress or eliminate those links. Our second impact was to spread awareness about sudden cardiac arrest. The research about sudden cardiac arrest is there, and SCARF's social media, along with Project Escalate, provide the necessary link to the public, ensuring that members of the community are aware of the information that we shared here today. We also are constantly fundraising for an AED. Use of an AED improves cardiac arrest survival rates up to 90% than without the use of an AED. Therefore, fundraising for an AED, along with the Project Escalate AED location app integration, allows us to achieve our goal of reducing sudden cardiac arrest in our community. Project Escalate researches the characteristics of sudden cardiac arrest, the effect of COVID-19 on the heart, and the disparities of COVID-19 and sudden cardiac arrest. In the bigger picture, to better save lives, Project Escalate aims to globally standardize CPR training and AED access on an in-person level where communication is adept, and on a virtual level where thousands can be reached. We plan to also give AEDs to the community, and what makes our AED access unique is our commitment to the community. Everyone involved and impacted by the AED. Contributors to the AED and organizers and fundraisers for the AED will be knowledgeable of its placement and its use. We hope that you will support the mission of Project Escalate, fighting cardiac arrest during a time of desperate need. Thank you for your time.